I'm Dwayne Brown. Tonight on KPBS Evening Edition, the first signs of football season. Training camp kicking off today for the Chargers.
Inside that locker room, it hasn't really been a distraction because it is something we can't control.
I think San Diego has some of the greatest fans in the world,
The players and fans trying to keep their mind on the game and off the stadium talks.
Medicare turned 50 today. I'm Peggy Pico with how it's transformed healthcare in America and what to expect for the future. Also ahead, the number of expelled students at San Diego Unified Schools has significantly dropped. Why students want to expand the district's restorative justice program.
In this case, they crossed a line in the sand.
A turf war shaping up in the science world. The heavy hitter from LA stepping on toes as it tries to expand into San Diego. KPBS Evening Edition starts right now. Hi, good evening. Thanks for joining us. California water officials say June was a very good month for conservation. An overwhelming majority of state water districts hit or were very close to meeting state water conservation goals. KPBS reporter Eric Anderson has details.
June was the first month that water districts faced the possibility of a fine if they didn't meet water conservation targets. Now, those targets range from between 8 and 35% less water used than the same month 2 years ago. State Water Board's Felicia Marcus is pleased that so many of the state's urban water districts hit their mark. Overall, the state conserved a little more than 27%, which surpassed the 25% goal.
In June, as compared to June of 2013, large urban water agency customers in California saved over 182,000 acre-feet of water more than they did 2 years ago. That's enough for 400,000 homes for 2 years. So it's a magnitude of water that is, in essence, in the bank in case this drought goes on another year.
Marcus said that 16 water districts missed their mark by a substantial margin. 6 of the districts falling short are here in San Diego County. June was the first month that fines could be issued for missing conservation targets, but state officials didn't mete out any fiscal pain. They said they're going to talk to each district to see if there are special circumstances that contributed to their poor performance, and they'll help districts implement plans to cut water usage. But state officials say that districts will face fines if there isn't movement toward conservation goals in a couple of weeks. Eric Anderson, KPBS News.
Blame it on global warming. A new statewide poll finds nearly 2/3 of Californians believe global warming is a major factor in the state's drought. Those findings come from the Public Policy Institute, and they come as the Governor Brown, presses for tougher climate change standards. That poll shows 79% of those surveyed think global warming is a very serious or somewhat serious threat to California's quality of life. On hold tonight, plans to expand tanks for killer whale shows at SeaWorld. The LA Times says the California Coastal Commission delayed a vote on the project for 2 months. It received nearly 75,000 letters and emails, mostly opposed to the expansion. Critics say the project is a marketing ploy to fool the public into thinking this is a healthy environment for whales. Supporters disagree, saying this helps create research opportunities. The Chargers opened training camp today before a big crowd of fans. Many wondered whether they were watching the beginning of the team's last season in San Diego. As KPBS reporter Steve Walsh shows us, stadium talks are on everyone's mind.
There was a cautious optimism from both the team and its fans as the Chargers began the first day of what could be the final season in San Diego. This was the first time that Crystal Herrera of San Diego had been at Chargers Park, and she was hoping it wouldn't be the last.
Well, obviously everybody wants him to stay here. That's personally what I want, but whatever happens is going to happen. I'll always follow them.
George Evan grew up in San Diego. He's been going to games since the Chargers came to the city in 1961. He says he's already seen some dampening of interest as the team talks about leaving for L.A.
Chargers report that their ticket sales are better than ever, so I'm not sure what that means. Maybe just a chance to get some of the last tickets here in San Diego.
The city has set a September 11th deadline for the Chargers to commit to staying in San Diego to keep to the city's schedule for a January referendum on a new stadium. Whether or not the city and the team come back to the bargaining table Chargers corner and Oceanside native Richard Crawford said the prospect of a last season is a moment for the community to bond.
So I think it's going to bring us together as a city and as a team. Whatever the situation is, I think it's just going to bring us all together. I think that's why we see so many fans out here today.
Steve Walsh, KPBS News.
A disturbing find at the site of next year's Summer Olympic Games in Rio de Janeiro. Athletes may be swimming and boating in raw sewage. Associated Press reporter Luke Sheridan shows us the contaminated water.
The beauty of Rio de Janeiro's mountains, bays, and beaches offers a dramatic backdrop for next year's Summer Olympics. But the waters, where swimming and boating events will take place, are so contaminated with human feces that athletes face the risk of becoming violently ill and unable to finish the games.
I've never seen numbers this high reported, at least in the literature I've read.
A 5-month investigation by the Associated Press found dangerously high levels of viruses which can cause fevers, vomiting, and diarrhea. More than 150 water samples were collected by a top Brazilian virologist during 4 rounds of tests. Samples from the Rodrigo de Freitas Lake, which will host the rowing and canoeing competitions, measured up to 1.7 million times the level that would be alarming on a Southern California beach.
We used to use it to
John Griffith, a marine biologist from Southern California, examined the protocols, methodology, and results of the AP tests.
The numbers actually that were generated are more than we typically see in raw sewage in the United States.
The AP investigation includes the first comprehensive testing for both viruses and bacteria at the Olympic sites. The Brazilian environmental agencies only test for bacteria levels.
You don't have standards for the quantity of virus in relation to human health when it comes to contact with water. You can have that for suitability for drinking, but for contact and recreation, that standard still does not exist.
Nearly 1,400 athletes will be sailing in Guanabara Bay, swimming off Copacabana Beach, and canoeing and rowing in Rodrigo de Freitas Lake.
Yeah, this is by far the worst water quality we've ever seen in our sailing careers.
Another expert who examined the AP data estimated that international athletes would have a 99% chance of infection if they ingested the equivalent of just 3 teaspoons of water. Whether a person will fall ill depends on immunity and other factors.
Yeah, we had a few sailors who were getting problems and they were getting sick and diarrheas, and I'm quite sure if you swim in this water and it goes into your mouth or nose that quite a lot of bad things are coming inside your body.
Periodic die-offs leave the competition lake littered with rotted fish corpses. The once crystalline bay is strewn with household debris. Despite decades of official pledges to clean up the mess, the problem remains. It stems from an explosive population growth and an infrastructure that failed to keep pace. Most raw waste runs through open-air ditches to streams and rivers that feed the Olympic water sites.
The levels of sewage treatment in Brazil are very low, about 16% to 20% nationwide. Unfortunately, we still have levels comparable to some African nations and to India.
As part of its Olympic bid, Rio promised to build 8 treatment facilities. As of now, only 1 has been built. For the Austrian sailors, the best course of action is simply to keep their heads above water.
We are doing the best we can, but if you get strong winds, the situation is quite out of your control. You capsize, you swim, and then there's a problem.
As the clock ticks down, local officials say there's simply not enough time to clean up the waters ahead of the games. Luke Sheridan, The Associated Press.
Keeping kids in school and out of trouble. We first told you about San Diego students who are asking the school district to expand a discipline program. Peggy Pico takes a look at how it works.
The discipline program at San Diego Unified Schools focuses on the root cause of behaviors that get students into trouble instead of simply kicking kids out of school. The result, the number of expelled students dropped by 60% last year. Here with more on the restorative justice program are my guests, Vernon Moore, San Diego Unified's Executive Director of Youth Advocacy, and KPBS education reporter Matt Bowler. And Vernon, remind us of how the restorative justice program works.
Well, restorative justice is a mechanism where school leaders and administrators can bring our students, our staff, and community together to discuss incidents that have happened on our campuses. And sometimes it's used in lieu of a suspension or recommendation for expulsion, but oftentimes it can be done in conjunction with those disciplinary measures, and it's an effort really to address incidents on campus, but most importantly to bring dialogue to repair the harm that occurred from an incident.
Give me some specifics, if you could, about how do you get to these root behaviors? So let's say you have these meetings, these discussions, and you discover something, like how do you get at to what the real issue is?
Well, I think the best way to get at the root behavior would be with a trained facilitator facilitating what we call restorative circles or restorative conference, where let's say two students got into a fight, that person would be able to, in this circle, have students really voice what happened, how they felt, how viewing the fight made them feel, or when things occurred made them feel. And through that, we're able to refer students to our other programs. We have counseling and guidance, mental health resource, and to other departments that can really delve deeply into whatever the students are facing.
Getting out at the root cause there. Now, Matt, your report this week focused on students at Crawford, right? And so they're the ones involved in the program there at that school. What did they tell you about the program?
Well, Crawford has the Academy of Law, which is a special sort of school within a school where they teach these kids the A through G standards, but from a sort of a legal perspective. So a lot of these kids want to become lawyers or become involved in the law in some way. So they see this as great kind of practice in a lot of ways. They see it as a real success story. They feel as though they're having an impact in their schools, although they would like to have more of an impact. They were asking the board for things like a stable classroom, possibly trying to figure out a way within the school day to give more time to these restorative circles because they're seeing so much success with them.
Sure. So you mentioned stable classrooms. So what is a stable classroom, and how does that compare to what's going on now?
Well, right now they kind of beg and borrow where they're going to do these circles at. They go to a history teacher says, yeah, use my classroom, and math teacher can't volunteer the classroom because he's got to teach class, or so they're kind of begging and borrowing right now. But they just want to expand and stabilize the practice at Crawford High.
And is there any peer mentoring going on at Crawford, or is that part of the whole program as well?
Well, I feel like that's happening within the restorative circles as well. If the two kids who are in a fight are two hypothetical kids who are fighting, they're not there alone with parents and administrators. There's other students there kind of with them, helping them, validating their feelings and validating their perspective on things, but helping them learn why they shouldn't be fighting and what the root problem is.
Sure. So what about, Vernon, I know that there's this expansion both from the students and the district as well for next year. So what's in store for that? How do you want to expand it?
Well, of course, we're looking at resources because we want to ensure that our students have the resources and our administrators and faculty teams have the resources to continue on with this program, and stable classrooms and places like that certainly are at the top of the list. But what we're really focusing on for next year is training and building capacity at our school sites. That's where we see the most impact, is when a school site as a whole embraces restorative work, then it can have a tremendous impact on suspensions, on recommendations for expulsion, and overall campus climate. We have the example of Crawford High School, and another high school in the City Heights area, Hoover High School, has also brought in this restorative work. It came out in another way. They don't have an Academy of Law the same way Crawford does. Instead, many of the staff members were trained. Teachers were using restorative circles in their classroom for instruction and such. And so that school also experienced some extraordinary results and drops in suspensions and recommendations for expulsions.
60% in 1 year. That's pretty impressive. We are unfortunately out of time, so Vernon Moore and KPBS education reporter Matt Bowler, thank you so much.
Thank you. Thank you.
A legal fight highlighting the high-stakes world of research in San Diego. USC and UC San Diego in court after a prominent Alzheimer's scientist left for a new job. KPBS science reporter David Wagner says the case spotlights USC's controversial plans to expand into San Diego science.
The legal fight focuses on control of the Alzheimer's Disease Cooperative Study, ADCS for short. This program aims to find new Alzheimer's drugs by collecting data from clinical trials across the country. UC San Diego has run the program for nearly 25 years, and Paul Asen was its most recent director. That is, until he resigned last month and took a new position at USC. UC San Diego lawyer Dan Sharp argued in court last week that Asen planned to take the program to USC without UC San Diego's permission.
Dr. Asen and USC began negotiations to transfer the ADCS in its entirety from UC San Diego to USC. These were not negotiations over a recruitment of a single faculty member. They were negotiations to take the entire center and all its grant funding.
It's not unusual for scientists to bring research projects from one institution to another, but UC San Diego Dean Gary Firestein says this program is too big to move, and he says Asen and USC botched the departure.
We've been involved with transfer of large grants and programs in a collegial manner for years and years. In this case, they crossed a line in the sand.
Paul Asen used to work here at the ADCS office buildings near campus. UC San Diego officials say he resigned abruptly with little warning, and they say he conspired to take the program's central database with him, locking UC San Diego out of a program they say is rightfully theirs.
The most striking event that occurred was the migration of all of the data into a personal account from a UCSD paid-for account. That is essentially unheard of and is not something that anyone would have imagined a faculty member would do.
UC San Diego says the database was transferred into a personal Amazon cloud account. Asen claimed UC San Diego could still view the database, but UC San Diego claimed Asen left them unable to control it. Last week, a judge ordered the database be returned to UC San Diego. Here's how Firestein described the situation prior to the judge's decision.
We can see that things are happening on it, but we are not able to operate it. It's very similar to someone stealing your car and saying that you can look at it whenever you want to, but you can't drive it.
USC did not grant an interview for this story, and neither did Paul Asen. But in court papers, Asen says UC San Diego did not properly support this program. He says the university's excessive bureaucracy hampered his ability to run the ADCS. USC lawyers say Asen took the database to USC because it was in the best interest of Alzheimer's research. This is not the first time USC has tried to expand its research footprint in San Diego. Last year, they tried to buy out this well-respected organization, the Scripps Research Institute. Staff here were not happy, and USC did eventually back down. I came here to talk with one scientist about why researchers resisted the USC takeover.
It seemed very, very odd to us that nobody at USC got in touch with us at all.
Stem cell scientist Jean Loring says faculty were not told about USC's plan until it was presented to them as a done deal. She says it was that secrecy that led faculty to reject the plan.
Within a month, I believe, of us starting to find out, we decided to vote no confidence in our president and tell our board that we needed another approach.
Loring welcomes USC's efforts to invest more in science, but she says their reputation was an impediment to winning over faculty at Scripps.
Let me tell you what my graduate students said when they heard the rumors that USC might take us over. They said, "I don't want to graduate from USC. It's not as prestigious. I want to graduate from Scripps." You know, so I thought that was probably a pretty strong feeling among many people in San Diego.
USC has now successfully added a top Alzheimer's scientist to their staff. But following the judge's decision, it's clear USC will not have control over this major Alzheimer's research database. The trial is ongoing, and it remains to be seen whether UC San Diego will be awarded monetary damages over Paul Asen's resignation. David Wagner, KPBS News.
A San Diego-based company agreed to a legal settlement over allegations of false claims on medical devices and kickbacks to doctors. NuVasive will pay the U.S. government more than $13 million. The company says the settlement is not an admission of wrongdoing. Today marks Medicare and Medicaid's 50th anniversary, and according to a recent poll by the Kaiser Family Foundation, the federal health insurance programs for the elderly and the poor are important to a large share of Americans. 77% of those surveyed said they think Medicare is very important, but not as many felt the same way about Medicaid. Peggy Pico has more.
President Lyndon B. Johnson signed the health insurance programs into law 5 decades ago. Today, about 55 million Americans have Medicare and more than 70 million have Medicaid, called Medi-Cal in California. But as the country's population grows older, some fear the programs may not be viable in the future. Joining me with a look back and forward is my guest, Susan Chanik, Director of the Institute of Health Studies at California Western School of Law. And Susan, Medicare is credited with transforming medical care here in the U.S. What has it accomplished?
It's accomplished an enormous amount. Before Medicare, at least 50% of seniors didn't have health insurance. And so that if they had illnesses and they had to be in the hospital and that sort of thing, it was really devastating for them financially. And they couldn't get insurance because they were older, no longer working, not eligible for employer-sponsored insurance, or private insurance for that matter, because they were bad risks for the private insurers. So Medicare really changed the world of access to health care for seniors.
For seniors. Now, today's Medicare certainly looks a lot different than it did back in 1965. How has it changed over the last 50 years, the actual program itself?
The actual program itself has expanded. The population in the program is somewhat different because life expectancy is so much longer now than it was in 1965. So that there are people who stay in the program longer and can and use the facilities of the program. And in addition to that, people are older. There are really elderly people. About I think 20% of Medicare beneficiaries are over the age of 85. So these are people who really have a lot of health care needs and therefore high health care costs. So that's changed. In addition to which, there are benefits that have been added. A population of permanently disabled people now are covered by Medicare, who can be under the age of 65. People with end-stage kidney disease are covered by Medicare, even though they're under the age of 65. There's now a outpatient prescription drug benefit that's available to Medicare beneficiaries that was not available in the beginning.
Sure. So you mentioned this expanding older age population because we're living longer. Are there other challenges for the program for Medicare?
Besides the old, yes, I think there probably are challenges for any program that's been in effect for 50 years, and it's sort of amazing that this program has been in effect for 50 years. It makes me feel old. But yeah, I think that there are all kinds of challenges. One challenge is cost. The program, when it was first went into effect, cost $3 billion a year. When in this year or in 2014, the cost was more like $600 billion. So the cost has really risen. But of course, all healthcare costs have risen. It's not Medicare itself, but all healthcare costs.
Sure, and that's my question. What's behind Medicare's escalating cost? Is it the healthcare escalating the cost there, or are there other issues as well?
Yeah, I think that there are all kinds of issues. I think there are issues of reimbursement, which haven't been done as artfully as they might be, and it's something that Medicare is really working on. But I think there are other kinds of issues like technology, ever-increasing technology, and people wanting whatever it is that's the new cutting-edge kind of technology that makes all healthcare very expensive.
A lot more expensive. And going on that note, then, the big question in people's mind is Medicare financially sustainable? And if it is, what's being done to keep Medicare around for future generations?
Well, I think Medicare is sustainable. I mean, it's an entitlement program, and the government can decide, or the people can decide, that they're going to spend whatever it takes to cover all of these seniors. So it's not a program that's going to go away unless we all decide that it should be going away. Secondly, I think there are a lot of things being done to curtail costs. The Affordable Care Act has made a lot of of changes and has initiated a lot of programs that are intended to cut costs of Medicare and other in private healthcare as well. And I think there's a lot of now looking into changes in insurance design to deal with what are the benefit gaps of Medicare and the problem of very high out-of-pocket costs for a lot of people who can't afford those out-of-pocket costs.
But you said it here, it's sustainable in the future. I think that's what people wanted to hear. Well, Susan Chanik, thank you so much.
It's lovely. It was nice to be here. Thank you.
Ready for Sin City? There's a new nonstop option for San Diego travelers. Biz Air Shuttle now offers flights out of Palomar Airport in Carlsbad. It's the first airline providing the service. County leaders say it's as easy as a drive-through Vegas wedding. They say it offers an alternative to crowds and traffic at the downtown airport. We should gradually be drying out here in San Diego. A mix of sun and clouds over the next few days by the beaches with 70s and 80s. 80s as well expected in the inland valleys. Rain, though, expected in the mountains with 80s. And it is hot in the desert, triple-digit temperatures there. You can find tonight's stories on our website, kpbs.org/Evening Edition. Thanks for joining us. Have a good night.